Ideally, you shouldn't ever have to treat yourself. Ideally, but we don't live in an ideal world. And my feeling is that if you realize you have schizophrenia, and you read about the orthomolecular treatment, and if you can't find a doctor that's willing to treat you, then you have to do it yourself. And no, you can't do that with drugs. You can't treat yourself with drugs because they're too dangerous. But you can do that with vitamins because people don't die from vitamins. There hasn't been a death from vitamins in the past 40 years anywhere in the world. But as you know, in the United States alone, 110,000 people die each year from the use of drugs prescribed properly in hospitals. With vitamins, you can play with them because they are safe. So my recommendation is that they read the literature, read my books, other books as well, make the necessary changes in their diet, make the necessary changes in taking the vitamins, try to get their GP or their doctor to cooperate with them. If they can't, to go ahead on their own. Now, most patients don't even ask me. They read our books, so they go ahead on their own. They don't need my permission to go ahead and start using vitamins. And many people are getting well, and they're just now, over the past 5 years, they're beginning to reveal themselves and to let me know that this is what they have been doing. Now, overall, you can divide your schizophrenic patients into those who have been sick for less than 2 years, and those who have been sick forever, almost from the time. And with the first class of patients, and this is based upon my own experience on having treated over 5,000 patients since 1952, if these patients will agree to accept the treatment for at least 2 years, 90% will be well. 90% will be well. With the chronic group, the ones who have been sick a lot longer, I did a survey of my patients who had been sick. They had been sick at least 10 years. They had failed to respond to any modern treatment, and then they came under my control. And I have a large number. I have about 500 schizophrenic patients that I've been seeing over the years. Some of them I see them once a year, sometimes once every 3-4 years. Some I don't ever have to see them anymore. Some have become good friends of mine. They're happy, doing what they're supposed to do. They're getting along really well. So I looked at these chronic patients. I did a survey of some of them. I couldn't examine them all. So I surveyed about 30. And I found that of these 30 who had been sick that long, half of them were well. Half. The other half were better. They hadn't recovered. And I have a few patients who were taking 20 years. I have a few patients that took 20 years of treatment before they became normal. 20 years.
And how long did it take for the chronic patients to start to show improvement?
Some of them will start to show within a year or two. Some will start within 5 years. And these 20-year-old ones, they didn't show any improvement for at least 20 years.
20 years.
Yeah.